health.
Good evening and welcome to Bethany TV, and you are watching live the Pediatric Voice, your usual show where you get to learn a lot of things about child health. That is how best to raise a child, what are the danger signs in a child, and a different childhood illness. Well, I'm your host, Dr. Helen Namsoke, and today we are discussing something very, very interesting on this last day of January of 2024, that is anemia in children. Now, it is well known that children are born with a high hemoglobin level, that is a lot of blood within their body, but they tend to lose a lot of this blood, and very often you are told that your child has low levels of blood count within their body. The question is, what causes it? What can be done about it? Very often we see most of you give children a lot of syrups, iron supplements, become iron supplements, and so much more. But the question is all anemia caused by lack of iron or loss of iron within the body? And if so, what really causes them to lose this iron within the body? And what can we do as parents? And when can we seek care? When should we give the iron supplements? And so much more. It is such a very interesting topic, and please feel free to call in your friend to tune in. That is to Go TV channel 841, free to air channel 170, and Star Times. Feel free to call in your friends to share, subscribe, share with them the link that is on Bethany TV Uganda, on X-Spaces, on Facebook and YouTube. Now today I'm hosting one of our doctors, that is Dr. Allen Twine. She is a medical officer at the Bethany Women and Family Hospital. She works in the Department of Pediatrics and Child Health. She is very passionate about taking care of children, and very interested in hematological conditions, that is diseases of the blood. She loves listening to music and reading, and she is here to discuss for us anemia in children. Welcome to the Pediatric Voice, Dr. Allen.
Thank you, Dr. Helen, for hosting me. I appreciate the opportunity.
Yes, our viewers out there would want to get to know you a little more.
Okay. So I'm called Dr. Twine Allen. I'm a medical officer working with Bethany. Currently, I am working with children, that is from birth to the age of 18. And I enjoy what I do, and I'm really glad that I'm actually here to share with you this information.
Thank you very, very much. I'm very sure many of you are eager to learn more, to know what you can do about a child with low blood count. How would you know that your child actually has very low blood counts, and so much more? But before we delve deep into the discussion, let's first have a documentary on anemia in children.
Anemia is a condition in which the number of red blood cells, or the hemoglobin concentration within them, is lower than normal. Hemoglobin is needed to carry oxygen, and if you have too few or abnormal red blood cells or not enough hemoglobin, there will be a decreased capacity of the blood to carry oxygen to the body's tissues. This results in symptoms such as fatigue, weakness, dizziness, and shortness of breath, among others. The optimal hemoglobin concentration required to meet physiological needs varies by age, sex, elevation of residence, smoking habits, and pregnancy status. Anemia may be caused by several factors like nutrient deficiencies through inadequate diets or inadequate absorption of nutrients, infections like malaria, parasitic infections, tuberculosis, HIV, inflammation, chronic diseases, gynecological and obstetric conditions like excessive menstrual bleeding, and inherited red blood cell disorders like sickle cell anemia. The most common nutritional cause of anemia is iron deficiency, although deficiencies in folate, vitamins B12 and A are also important causes. Anemia is a serious global public health problem that particularly affects young children, menstruating adolescent girls and women, pregnant and postpartum women. World Health Organization estimates that 40% of children 6 to 59 months of age, 37% of pregnant women, and 30% of women 15 to 49 years of age worldwide are anemic. If not treated on time, may lead to lifelong complications like heart failure, chronic hypoxia, and early death.
Almost 40% of children are living with it, and to our surprise, it's actually not affecting. It's affecting children mainly in two subsections. That is the young ones, that is the under fives, as well as our children that are going through adolescence, the young adults. So, what is your comment about that documentary?
So the documentary actually is summarizing everything I was supposed to talk about. It's quite detailed. Described what anemia is, which is basically not having enough blood in your body. And yes, commonly the children who are affected are those below the age of 5 and the adolescent, especially for the girls who are starting their menstruation. And yes, for the children below the age of 5, there are so many causes of anemia actually, but the commonest one is actually due to nutrition. So
before you go into the causes, maybe our viewers out there would want to understand what exactly, when you say, they keep saying, they told me that my child has low blood count, low blood count, low blood count. Others say, they told me anemia. What is anemia?
Okay, so anemia is a condition where the body is not having enough either red blood cells or the protein called hemoglobin, that is the functional point of the red blood cells. So this...
What do you mean by a functional point?
So the red blood cell is the structure that will hold the hemoglobin. And the hemoglobin is one that carries out the function that the red blood cells is supposed to do. So if you're not having enough red blood cells, you will be anemic. If you don't have the protein that is the functional point of those red blood cells, you'll still be anemic, and that's what we call anemia.
Okay, dear viewers, you all very well are aware that our blood is color red. Now, what makes it color red are what we call the red blood cells. So inside these red blood cells, there is can I call it a pigment or a component that actually makes it red? And it's called hemoglobin. And its main role in the body is to transfer oxygen from one point of the body to the other parts of the body. That is from the lungs to the rest of the parts of the body. Yes, you can continue, doctor.
So the fact that its major role is to carry oxygen to every single organ in the body, to the brain, to the heart itself, to the muscles. It is a vital protein, the hemoglobin and the red blood cells. They are a vital requirement for the growth of the children, for the betterment of their growth. Because at the age between from 0 to 5 years, we are having rapid growth that is going on. And to support this, we are supposed to provide enough nutrients for the body, and oxygen is one of them.
That is such an interesting discussion. Please keep tuned in as we discuss more about anemia. As you've very well known that anemia is a disease that is associated with either low red blood cell count or low hemoglobin levels within the body. Let's come back shortly after break as we discuss more about anemia in children.
Bethany TV for health. Introducing Disney Junior and Daycare Center, a school that will guarantee your child excellent education. The school has professional and competent teachers who will take good care of your child. Disney Junior and Daycare Center at Natete has conducive and comfortable environment for your child. The dine is just right for your child, and transportation is well catered for. They have vans and qualified drivers. Look nowhere for your children's education. Bring them to Disney Junior and Daycare Center at Natete. Disney Junior and Daycare Center for a firm foundation.
Exciting news for all viewers of Bethany TV. Bethany TV, the premier health TV channel in Uganda and Africa, and also your favorite TV station, is now on Star Times. You can now watch Bethany TV day and night, weekdays and weekends on Star Times, channel 271. Catch your favorite programs on health, wellness, entertainment, and so much more. Bethany TV is also available on free-to-air, GoTV, YoTV, Airtel TV, and Afro mobile apps. Not forgetting online via our website www.bethanytv.ug and social media platforms at Bethany TV UG. Bethany TV for health. Bethany TV for health.
Welcome back from the break, and thank you for watching Bethany TV for health. Now today on the Pediatric Voice, we are discussing anemia in children. I'm Dr. Helen Namsoke, and we are hosting Dr. Twine Allen, who's a medical officer at the Bethany Women and Family Hospital. Now, Dr. Allen, you had earlier discussed what anemia is before we broke off. That is having low levels of red blood cells or low levels of hemoglobin within the body, and this actually affects oxygen circulation within the body. So what really causes the levels to go down?
So we can start even all the way before conception. So when a mother, before you even get pregnant, you are supposed to have enough iron stores to share with your baby when you finally conceive. So if you don't have that, if you have not been taking care of yourself while eating nutritious foods, chances are high that the child you'll give birth to will be having low levels of what? Of blood. Will be anemic. And then also through the pregnancy, the supplements we give to mothers, they're also important. Then after delivery, remember we're supposed to breastfeed our babies exclusively for 6 months, and then we are supposed to still continue breastfeeding them up to 2 years as we give them the complementary foods. So if we're not doing this in the right way, this can be a problem that brings up the anemia.
So in other words, if my mother is anemic, the child is likely to get anemic as well.
Yes.
But the statistics show that by default, almost all African mothers are anemic.
Yes. So, and that is why it is recommended that all mothers who are having plans to get pregnant, you start before you get pregnant. You're supposed to give yourself these supplements way before you get pregnant, so that your iron stores that help you produce the blood are readily available for you and the baby you're going to carry. Okay. And you're supposed to continue this throughout also the pregnancy. Because it's already known, most of us are deficient in iron, and so we don't want that to cross over to our baby. So we're supposed to plan for them.
Okay, that is very interesting. Okay, any other causes of anemia?
So the other biggest cause of anemia is actually, like I said, nutrition with the breastfeeding, and also the choice of foods that we give to our children when they are starting to wean off the breast milk. Then we have other causes like infections, like the short film short. We have the parasites, where we know like the tapeworms, the hookworms, and also diseases as common as malaria.
Very interesting. That means they need to deworm the children.
Yes.
On time.
On time.
Okay. Dear viewers, as long as your child is less than 5 years, you have to deworm the child every 6 months from their first birthday, then every 6 months of their life, or anytime when there is a confirmed parasite within their body.
Yes.
Okay.
So the other causes, really, we have the genetic causes, and usually those are more complicated cases. And the commonest that the public knows is sickle cell. Sickle cell is one of the diseases that gives us anemia. There are also other genetic disorders out there. Yes.
Okay, having seen the causes of anemia in children, as a parent out there, I may not be knowing the cause is for you, the health worker, but how would I identify that maybe my child could be anemic out there in the community?
So just to put this across first, before the symptoms show up, most children are already anemic. By the time the symptoms come up, chances of you having already severe anemia, meaning the levels of blood are so low and we shall need to give a medical intervention, will be high. So most children actually are anemic and you don't know. So if I talk about these symptoms, you're going to note that you can look out for your children. Usually that means we are almost getting into the severe states of anemia. But usually anemia commonly presents with very non-specific symptoms. Symptoms like headache, symptoms like dizziness. You'll see a baby not playing, prefers to sleep, is preferring to sit, a baby who was very active before. You'll see your baby playing and getting tired easily, breathing very fast. They get tired so easily. The other things is you can also look at your baby. You look at the color of the palms of your hands, and you compare that with your baby. If your baby's palms are paler, chances are high that they are anemic. Or you can look at the eyes, the under part of the eyes. The eyelids, the inside part, the red part, which we call the conjunctiva. That also, if at all it is pale, it can show you that your baby is having anemia. And then for the older children who can tell you out their symptoms, they'll tell you, Mommy, my heart is beating so fast. I can feel my heart is beating so fast. That is also another symptom. Then the other symptom that you could have realized much later is you realize your baby is not gaining weight as the other children. Your baby is not growing tall as the other children. They're not developing as well as the other children. So that is also one of the complications of being anemic, and it's a symptom that shows up later on when the damage has already been done.
So having seen that most of the time the symptoms are seen when there is damage, when it is in the severe form, how would someone identify that their child is anemic when it's still early?
So when it is still early, what we recommend is that having routine hospital visits with your doctor. Okay, this is the easiest way you can easily, before the symptoms show up, because I already said when the symptoms show up, the anemia has been happening over a very long period of time.
So you mean it is very okay for a parent to walk into the facility for the child just to be assessed even when they are not sick?
Yes, it is okay.
You see, for us in the African setting, I don't know, we are not into the habit of routine medical checkups.
Yes. But the good thing is that the tests that actually check for this, that check for the anemia, are tests that are commonly done when your child is sick. When a child is having a fever, they usually do this test. So it is easy to notice.
So one way of knowing whether the child is anemic is during the normal hospital visit.
During the normal hospital visit. Yes.
And I think the other opportunity is when the child comes in for the routine immunization.
Yes.
Actually, I encourage parents not to miss immunization sessions because it is their opportunity to get to know a lot about their children, as the health workers get a chance to assess the children's general state, because it's not only about putting the injection into the skin. and giving a particular vaccine, but a health workers take a step in assessing the child's well-being, including the nutritional status of the child, the growth and development of the child, and so they get to get a thorough report about the well-being of the child and pick some of these conditions like anemia that is existing in the children. And sometimes you parents may not actually know that a child is sick, and that is their opportunity to find out, or your opportunity to find out that your child is actually unwell. And this goes to the health workers. Please, every time you are immunizing a child, do not just put the needle to the body, but take a time to assess the general condition of the child before you put the needle into the body, because this helps you to pick some of these conditions. Now, how would I know the cause of anemia in my child?
So the cause of anemia in your child, first of all, according to statistics, okay, that are done worldwide, especially actually in the sub-Saharan Africa that we live in, over 70% of children who are anemic are having it caused by having nutritional deficiencies. That is iron majorly. We have.
What do you mean by nutritional deficiencies?
Nutritional deficiencies, I mean the nutrients we get from food that we eat that help the body to grow. So if you don't have enough,
so it means someone did not eat and get enough nutrients from food.
Yes.
Okay.
Yes. So most times that is the commonest cause. And if at all there are other causes, usually those are most likely going to be found out in hospital when you go for assessment for your child. It would be hard for a mother to sit and look at the child and say, this is what is causing my child's anemia, because there are other tests we can do further to look out for what could be causing the anemia. But like I said, nutrition and also the routine deworming, those are some of the things you have to do so that you prevent it from happening.
How is deworming related to anemia?
Oh, so these worms that infest our digestive systems, the livers, they infest our bladders, the urinary tract especially, they cause bleeding when they lodge onto the tissues in the body. They cause bleeding, and those small losses are going to happen over a long period of time. And finally it will end up into having anemia. These same worms are competing with the nutrients your child is eating for themselves. So the child is not getting the nutrition you think you are giving to him or her.
So actually I'm feeding my child, but the worm is also feeding.
The worm is also feeding on the food you're giving to your child. So usually that is how they cause the what? The anemia.
Oh, I get it.
Yes.
Okay. So as a parent out there, how do I assess, having known that the child has anemia? I hear you keep saying nutrition anemia. So the parent out there, having been told that my child has what we call nutrition anemia, either that is anemia because of lack of enough nutrients within the body. That could be iron and other nutrients. How would I address it as in my way as a guardian, as a father, as a mom back home?
Okay. So first of all, you need to identify the foods that are rich in these nutrients that you're going to be giving to the child in proper proportions to the child. And thank God we are in Uganda, that is a hub of nutritious food readily available. Okay, so we have foods like the meats, that is beef. For those who eat pork, pork is also rich in it. Those who eat liver, chicken. For those who are vegetarians, we still have the dark green vegetables. We still have beans, and these are still commonly found sources of nutrients in on our market. They are always available. Okay, that is one way we can actually do that. The other thing is to identify the things that can actually take away our nutrients. I already talked about worms. Then we have things like giving your child a lot of tea as they are taking these things. Tea is actually one of the things that it contains an ingredient that prevents the absorption of iron.
What do you mean by tea? Chai majani.
Amajani kenyini.
You know, we call tea when we mean coffee, when, you know.
I'm meaning amajani, but even coffee too.
Okay.
But amajani majorly causes, like, prevents the absorption of these nutrients that help the body to build blood.
But amajani is the commonest ingredient we have on our market, in our setting.
Yes. So when you're giving your tea, you don't give it at the same time that you have your foods that are rich in what? In iron. You space them out. Like about 2 hours later, you give. Okay, that is very fine. Not that you take away the tea completely. No, it is okay. But don't give them at the same time.
Same time.
Okay. Yes. Then the other thing we can do is breastfeeding. For the people who have children below 1 year, especially those who are having babies below 6 months, exclusive breastfeeding, because they're getting some iron from the mother to the baby. It is also quite important.
Okay.
Yes.
Okay. What else can we do?
Then also, I know there are so many supplements on the market. I think I need to talk about it.
Give the supplements?
I was going to talk about it. There are so many supplements on the market. And to me, all drugs are poisons, and they should be recommended by a health worker. So if your health worker tells you that it is okay, you can give your baby supplements, it is okay to give your baby supplements. I don't really recommend self-medication. I don't want to say it on TV, just go and get the supplements. It should be under guidance of a health worker.
And if anything, if one chooses a certain syrup, they don't even know
that's
the dose
to give, yes.
Because different syrups have different concentrations of these nutrients. So there, one syrup you may need to take 5 ml, and another you may need to take 2.5, and another you may need to take 0 point something ml.
Or once a day, the others for twice a day. So clearly you need, it's a drug, and you need to get a prescription from a health worker before you take those supplements.
Okay, so having seen the signs and symptoms and the things we can do in our means at home, what are those triggers that would make someone say, honestly, I have to take this child to the facility? I think having been supplementing or feeding this child, trying to manage the anemia at home, things maybe are getting out of hand. And now I need to rush to the facility to seek care.
So the first thing you can look at is the baby pale, looking at the skin. There are mothers who have light-skinned babies, especially the newborns. Is your baby becoming pale every other day?
More light than usual.
More light than usual. That is an easy way to notice, and you can take your baby immediately to hospital. Is your baby not playing? Is your baby getting tired? Is sitting, walks around, just starts breathing heavily, getting tired easily? That is another thing to go to hospital immediately. Usually, there we are ending up in the severe forms of anemia. Then the other thing actually is when you notice that your child is not growing, if at all you have other children to compare to, especially if the child has older siblings, is not growing at the same rate as the others, is not developing at the same rate as others. Let me say the child is supposed to stand at this age, he is not standing. He's supposed to start talking, he is not talking. He's supposed to start holding toys and playing with them, and he is not doing all those things. There you need to look for assistance from a hospital.
Thank you very, very much. What are the complications of not managing the anemia in case someone is living with it and then it's not being treated?
Okay. So for someone who's living with anemia and it continues worsening, because remember, you're not replacing, so it's going to worsen over time. Remember, for children under 5, they're having a lot of rapid growth happening during that period. So if you're not having enough blood in your body, you're not supplying these organs enough oxygen for them to develop properly, especially things like the brain. Your child is going to have what we call cognitive impairment, which is more of the behavior of the child is not going to develop as the children who have enough blood in their bodies. And that is a terrible complication because most times it's irreversible. and you wouldn't want to wait for that. Then the other complication that can happen is getting into heart failure.
At a tender age?
At a tender age. And the child starts having heart diseases at a tender age. Because the heart is going to get tired to pump this little blood to supply to all these growing organs in the body. So the heart will finally fail and we get heart failure. And you wouldn't want your child to be one of those. So then the other complication of anemia is the child is not going to, I've talked about the growth, the child is not going to have behaviors like for other people. It's not going to grow tall as other people. And now especially when we reach the adolescent stage, they're going to have, for the girls especially, they're going to have problems with their periods when they reach their menstruation time. They're going to skip periods or delaying to have periods at such a tender age, which is quite frustrating to the parents and also the what?
So you
the
mean
patient.
Someone can miss their periods even when they are not pregnant?
Yes. It does happen to a majority of us. Yes, and sometimes it's normal for people who have irregular periods.
So if it happens, especially if I've been having regular periods,
and then all of us
I should think about could be anemia.
Yes.
Apart from having a pregnancy.
Yes.
So most of the time we always think when someone misses their period, they are pregnant.
Yes, especially for adolescents who are just starting. Usually they have, or even they can get late onset of their menstruations when they don't have enough iron.
Okay, so having seen the complications of anemia, how would one prevent this whole thing called anemia or having low blood count from happening to their child?
Okay.
Because I believe in prevention and I believe it's better than cure. Yes. So
actually the biggest way we can prevent our children from getting anemia is through food. Food majorly. Make sure you give your children food that are rich in things like iron, rich in vitamin B12, rich in also folate. Because these are the things that help in formation of blood. And I think I talked about the examples of foods that have these things, plus breastfeeding, taking your antenatal on time, also your preconception, supplement nutrition, you as the mother. Yes, that is the biggest way we can prevent anemia.
Okay. So they have to take their medications and all that. Okay. So in case, what is the worst that can happen if my child has anemia?
The worst is death. Death can happen. It's very common. Because, most times babies come to hospital when they're anemic and the first thing you want to do is transfuse them with blood. Because if it's not there, the body is not having a driving force to live. Because remember, blood is one that is supplying oxygen for these organs to live. So if the worst case scenario is actually death.
Okay. So in a minute, what is your take-home message to our viewers out there about anemia in children? So my take-home message to parents who have children is that anemia is having low blood, and this is a very, very common illness amongst our children, and it is living with us. Most times it is not symptomatic, so don't wait for the symptoms to come, because by the time they come probably you'll be having severe anemia, and it is easy to prevent by giving our children nutritious foods, and also making sure that when we deliver our babies we are breastfeeding exclusively for 6 months. We still continue breastfeeding for up to 2 years as we supplement our babies with foods that are rich in iron, vitamin B12, and also folate. Thank you very, very much, Dr. Allen Twine, for teaching the public about anemia in children. I'm very sure very many out there have picked a message or two, and they are going to do the needful, especially in the prevention of nutritional anemia. Well, we've been having Dr. Allen Twine, who is a medical officer at the Bethany Women and Family Hospital, and she has been teaching us about anemia in children. As she earlier discussed, anemia is a condition where one has low blood count or low hemoglobin count, that is the red pigment that is responsible for transporting oxygen from the lungs to the rest of the body tissues. And remember, no body organ can function very well without receiving adequate amounts or enough amounts of oxygen for its functioning. In other words, the body systems are all shut down progressively as the low blood count you have in the body, the lower the functioning or the deteriorating of the body, the functioning of your body system goes on happening, and eventually you get failure of the most vital organs in the body, that is the heart, and you end up with a chronic disease called heart failure, or the brain gets affected and your child's performance deteriorates, and you end up with behavior disabilities as well as learning disabilities. In this child, you find that the child who was earlier performing well eventually starts deteriorating in performance or gets abnormal behaviors, as we earlier saw. We learned about behavior disorders amongst children, and one of the commonest things that will happen that you find that the child is not growing adequately as compared to the rest of the children in the population. Find that yours is slower at attaining milestones, as well as maybe is not attaining the right size, that is the right height and the right weight on time as expected with the normal growth and development of children. Very interesting, studies show that almost 40% of our children in the African setting are living with anemia, and guess what? 70% of these it's actually caused by nutritional deficiencies, that is having low iron levels within the body as well as having low folic acid levels within the body. And guess what? Most of it is gotten from what we eat. However, it is also very important for a mother before you conceive to make sure that you have enough stores within the body, and also keep up to the volume during pregnancy, that is take your faithful folic acid and iron supplement. It is very unpleasant to take during pregnancy, but it's actually very important for you and for your baby even after birth, that is during the breastfeeding stage, because if you do not have enough reservoirs within your body, that means you remit very little within the breast milk, as well as transfer very little through the placenta to your baby. Just imagine your baby starting with a blood transfusion in just their first few days of life because you did not give them enough supplements during pregnancy. And would encourage you to give your children the right nutrients during a post breastfeeding period, that is during the weaning period. The greeny, the more color we give to the baby on the plate, that is the green vegetables, the yellow, the red fruits, that means we are giving them plenty of folic acid, as well as the meaty, the more meaty soup and meaty we give the children, liver, fish, meat, pork, we are giving them more of the iron within the body. We need to reduce some things like milk, as they may hinder, and tea, they may hinder absorption, especially if they are taken at the same time when the child is taking the foods that are rich with iron. For those of you who may not afford meat all on a regular, even the things on our market like silverfish, like guineas, they also have a significant quantity of iron, and they can be very, very important for your child's growth. That is it we had this week on the Pediatric Voice. I've been your host, Dr. Helen Namsoke. Till we meet next time as we work hard to promote good health amongst our children.